us your name for us first,
Is
please.
Denise Garner.
Yep, beautiful. And your title right here?
I'm the Disaster Manager at Murrumbidgee Local Health District.
It's beautiful. All good, guys. Alrighty, tell us what you're setting up today.
So today we're setting up a COVID testing clinic at the showground in Wagga. There's a couple of reasons we wanted to do it. At this time of year, with people having colds and things, it's also symptoms of COVID. So we needed to increase our testing capacity in the Wagga area. We picked the showground because it's central to the community. There's public transport that goes past the showground area. There's ample parking here, and there's different access and egress points, so cars can come in the Burke Street gate and then exit via the Urana Street gate. The hall here, the Show Society, has been great in helping us identify the best place to be and getting set up here yesterday and today. So we'll kick off from about 9 o'clock this morning. So people can make appointments to come to the clinic. They can make an appointment by calling our COVID hotline on 1800 831 099, or we accept people who walk in, so anyone who just wants to get tested today and walks into the clinic will be able to register and get tested as well.
And what's the process once they do arrive?
So we've got an entry door and an exit door. So once they come in the entry door, there'll be somebody to greet them there, to ask if they currently have symptoms. There are masks there available and hand sanitizer. So once we get them set up with those items, there's X's marked on the floor to help maintain social distancing. And we have them basically queue for a registration process. And once they've gone through that registration process, they head down to the other end of the hall where there are different coloured X's marked on the floor where they can line up for the actual swabbing process. So we expect to have capacity to test about 200 people through the clinic here today, and anyone that does ring up and make an appointment, the person that greets them at the door just sends them in a slightly different process to be able to get their swabs done, because we already have their details and it's a quicker process to be able to get somebody through who's got an appointment with the clinic. Why is the clinic? So the clinic that we've had at the hospital was in a much smaller location, and so it didn't have the capacity to be able to test the amount of people that we felt needed to in Wagga. So recently we had our mobile testing vans. They've been going to Apex Park out at Lake Albert. They've also been to the Ashmont Oval, and we found days that we have the pop-up van go out that we were testing an increased number of people to what we had capacity to do at the hospital. So the clinic that we have had at the hospital up till today, is basically relocating to here where we have a bigger venue. We've put some additional staff in, and we'll be able to increase from, instead of seeing about 50 people a day for testing, we'll be able to increase that to about 200.
So that hospital clinic now won't exist, or will still run in conjunction with this one?
No, the hospital clinic resources from there have been relocated to here, so this clinic will replace the clinic that was available at Wagga Base Hospital.
So has this clinic been set up in response to the family who got tested positive earlier in the week?
No, it's just coincidental that we had some positive cases in Wagga earlier in the week. We've actually been planning this clinic for almost 2 weeks now, so it was just incidental.
Even though they are isolating, do you hope that more people will come in as a result, I suppose, just in case to get checked?
I'm just hoping that anybody that has any symptoms of respiratory nature, whether it's a runny nose, a sore throat, a difference in their taste or smell, if they've got a cough, I hope anyone with even the mildest symptoms comes in and gets tested, because that's the way we can identify any circulating virus in the community.
What's the timeline, Denise? Once you come in, how long does it take you to get a test, and then how long do you get till you get your results back, I should say?
So it'll depend on the volume of people that come in, but if somebody presents, we expect them to be able to process through within about 10 minutes. So it'll just depend on the volume that we have in, how long it actually takes to get the registration process. But once you're registered, I expect you to be out of here within 10 minutes.
And then make sure you isolate. Obviously, we've had a bit of problems over the border with people not isolating.
Yeah,
once they get a
it's
test.
certainly important that people isolate until they get their results, and it'll only take 24 to 48 hours to get the results. So everybody who registers today and gets a test done will receive a bit of patient information that tells them about self-isolation, and it also gives them the best way to get their results. So there's an SMS text message that they can register for, and that's the quickest way to get your results. So I had a husband tested last weekend, and he got tested at 1:30 on Saturday, and he had a result before midday on Sunday. So it's not too long that you have to isolate for, but it's important that they do so.
Good,
Thanks very much.
Thank you very much.